A typical patient load for me every day is about 40 to 70 patients, depending on the physician I'm with and which clinic I'm working at.
Do you pick up the phone when Dr. London is calling? So, after each year, it can be a little stressful because after your first year, you want to relax, you want to chill, but that time between your first year and your second year is kind of the most critical. And so if you're looking for things to do or trying to figure out what to do, I have a friend who just completed a internship, research type of deal, which was very cool. He wants to be an orthopedic surgeon, so he completed this program, and I want you guys to have a look. And there's also, I want him to know that there's other programs like that. There's one for derm. I found one for pediatrics where you can study abroad, IR as well. So have a look in his, and hopefully that inspires you to do the same.
Hey, my name is Noah Thomas. I'm a current second-year medical student at Meharry Medical College. Today I'm going to be giving you a day in the life of a student on orthopedic surgery clinic and OR rotation with interventions. Let's get into it. I like to start my days around 6:30 a.m. Here you see me taking some caffeine, some fish oil, black seed oil, and a little bit of sea moss to kind of keep myself healthy and aware for the rest of the day. I will be gone for the majority of the day, so the last thing you want when you have a mask over your face is for your beer to be in your mouth or your breath to stink. So it's good to always get a good morning routine in. Here you see me taking a few of my supplements. That way I can be nice and ready for the gym. Again, since I will be gone all day, I always pack a lunch with me, a nice and healthy pre-made lunch. And I always put my white coat on afterwards because I do have a bad habit of spilling things. Now it's off to the clinic. I typically get to the clinic around 7:30 a.m. Even though it doesn't open up until 8:15. I like to get here early. That way I can kind of take a look at a few things, see what type of cases we have for the day. And if I have any research that I have to work on for that day, I can kind of knock it out here early in the morning before everything starts. A typical patient load for me every day is about 40 to 70 patients, depending on the physician I'm with and which clinic I'm working at. After our wonderful nurses have seen the patients, they come and bring us the clipboard, and it's time for me to go check the patient out. During these patient encounters, I'll be going to take the current history and the physical exams. I'm blessed enough to be able to be autonomous at this clinic, so for the most part, I'll be going to see these patients by myself, and I'll present them to my attending physician on the back end. I like to be really detail-oriented with my notes and with my assessments. That way, when it comes time to present to my attending physician, I can get everything that's pertinent, positive, pertinent, negative, and I have a real clean and smooth presentation to my physician. We typically end our clinic anywhere between 4:30 to 7. It just depends on which clinic I'm at. And then after that, I'll be off to the gym. This time is really important to me because it's the only time I can actually work on my fitness and have something outside of work to do. Shortly after the gym concludes, we do have lectures in the evening time. And then in the next morning, it's off to the OR. This is my favorite part of the entire experience. I actually get a chance to throw sutures. I actually get a chance to do some plating, some screws, some retracting, first assisting, and a whole bunch of other cool things within the OR. And that's one of my typical days within the Interventions program.